सो हेलो एंड नमस्कार सभी को। गुड मॉर्निंग, गुड इवनिंग टू ऑल। आप हमें जहां से भी सुन रहे हैं, मैं हूं आपकी होस्ट दिव्या एंड वेलकम टू टुडेज लाइव सेशन। सो टुडे वी आर गोइंग टू डिस्कस अबाउट द एक्ने and its treatment and tips. So viewers, you can watch our session on Facebook, Instagram, YouTube with our experts insights and join through your favorite platform and let us know your doubts in the comment box. So let's get started. So for today's session, we have our expert Dr. Karthik Sunki. So introducing Dr. Karthik. So he's a dedicated dermatologist hailing from Telangana. With over 3 years of specialized experience, Dr. Sunki combines cutting-edge dermatological practices with compassionate patient care, ensuring every patient receives the best in skin health and rejuvenation. So it's really nice to meet you virtually, Dr. Karthik.
Yeah. Hello, Divya. It's good to meet you on this evening. Yes.
Yes, sir. So, sir, should we start the session?
Yeah, sure.
Yeah. So, without any delay, so as we are going to discuss about the acne and its treatment, so my first question is, like, what causes acne and why might it worsen during the summer?
Usually, acne is seen between 13 to 21 years of age group, and it is mostly due to the hormonal changes. Sometimes there are multiple pathologies like clogging of pores, propionibacterium acnes, and of course the maintenance, skin health maintenance. If they are not washing frequently, then they are more prone to develop acne. And coming to uh, the aggravation of acne in summer, it can be due to, see, in summer we usually sweat a lot, so that also contribute to the flare up of acne in summers. Yes.
Okay. So as you explained the causes, so can you explain the different types of acne?
Yes. Usually, we divide acne into 4 grades, and there are different kinds of lesions which we see in every individual. Sometimes all of them may be present in a same individual, or most of them can be present in a single individual. We'll start with the basic lesion called as comedone. These comedones are nothing but blackheads and whiteheads. We usually call them blackheads and whiteheads. These are the basic lesions, followed by the papules. Papules are nothing but pimples in a skin colored. And next thing is a pustule. Pustule is a pimple which is filled with pus. And the last one is an nodulocystic acne. See, there is something called, these are nothing but bigger pimples which are sometimes painful, and the risk of these things are they can go into scarring. Yes, these are 4 different kinds of lesions in the acne, seen in the acne, and depending on the grade, we categorize it into grade 1, grade 2, grade 3, and 4. Yes.
So thank you, Dr. Karthik, for sharing the different types of acne. So building on that point, so like what are the treatment options available? Like what are the over-the-counter treatments are most effective for acne in summer?
Yes. Yes. First of all, over-the-counter medication can be taken when they have few lesions, and second thing, the size of the lesion is less. Simply, uh, if it is a very small pimple which is in the color of your skin, then you can take the over-the-counter medication, apply it, and use it. Whenever the pimple size increases or it turns into a red pimple or a pustule, then you need to see a doctor. So this is a basic understanding when we need to uh, go for the over-the-counter medication. And coming to the over-the-counter medication, we can use something called as clindamycin gels, and mostly we'll be getting clindamycin and adapalene combinations. And we have something called benzoyl peroxide. We can use it over the counter, buy it from over the counter and use it. Most of these creams, pimple creams, will be used at night time because they have an irritation potential, and it's better to apply it at the night time.
Okay. So moving further, sir. So as you mentioned about the over-the-counter treatments and medicines, so can you discuss any home remedies that might help the users?
Say, I usually suggest my patients not to go for any uh, homemade products or these things, but uh, we can suggest few general instructions which will help them to prevent acne. That would be better. Like drinking 3 to 4 liters of water per day is most important thing. Hydrating yourself is most important. Second thing, if you have pimples, then we can definitely avoid sweet sugar items and milk products. So these things will definitely help in preventing acne. And once you get acne, then don't any home remedies. Go to a dermatologist, see, then diagnose it and treat it.
So now turning our attention to a different aspect, I would love to discuss like before moving further, let me tell you that all the viewers, eGlobal Doctor is one complete healthcare platform solutions for all your medical related issues and questions. And मजे की बात ये है that you have these services available to you at your fingertips without breaking your bank balance and without driving all in the comfort of your living room. Sir, as we discussed about the treatments and like home remedies, so I wanted to ask, like, can you mention some prevention tips, like what can be done to prevent acne caused by sweating, or in summers, what we can do to prevent it?
Yes. Especially during summers, we can see, always we will be I mean, sometimes we'll be sweating a lot in summer. So people will be using some towels or napkins to clear it off. And if you are using a napkin, you should use a clean one. That is most important. And of course, using products like makeup products which we use should be avoided, if possible, should be avoided in the summers. And they can in turn cause the blocked pores, and they can lead to acne. So avoiding heavy makeup during summers and using and the next part is using lighter products. Like if you are using any cream based moisturizers, then you can shift to something which is light, like a gel based moisturizer, especially in the summers. Those can help in preventing the acne formation.
Okay. So, sir, like, can you give some advice for those with acne-prone skin who want to wear makeup in summer?
Yes, yes, definitely we can't avoid people uh, wearing makeup. And what we can use is a lighter makeup products, and there is something called non-comedogenic products. The non-comedogenic means it doesn't clog the pores and in turn cause the acne. So the molecule size will be very less and they won't clog the pores. So those kind of makeup products can be used during these summers. Sometimes it will be written as pimple free or acne free also. We should pick those products and use them.
Okay. So, sir, as you mentioned about the non-comedogenic like
Products.
makeup, so
Yeah.
can you mention some like as we are summer is here, so can you recommend some non-comedogenic sunscreens that are effective for acne-prone skin?
Yes. The simple thing to look for is it will be mentioned on the sunscreens or the packaging itself. So just look for the package and it will be written as non-comedogenic. Then you can use it. If you are doubtful, then we can avoid it. And if you want a specific names, there are many. And Acne UV is one of our favorite products. Revila Bronze, uh, of course, La Shield. All these things are very famous and they can be used.
Okay, so sir, can you mention some good moisturizer options for those who have oily and acne-prone skin? Because we have user commenting about the like options for moisturizers also.
Yes, there are, as I said, it will be, see, for oil prone skin. Nowadays, we get something called as oil control moisturizers also. There will be few ingredients which can control the secretions of the, at least decrease the secretions of the sebum. Sebum is nothing but oil secretions. So we can select oil control, oil control moisturizers or gel-based moisturizers. These are very good for oily skin and acne-prone skin. And there is a misconception that uh, moisturizer shouldn't be used in oily skin, and that is not right. Even if you have oily skin, there are specific moisturizers which can be used in oil-prone skins. Yes.
Okay. So thank you so much, Dr. Karthik. You explained very detailed uh, information for the acne. So, Dr. Karthik, can you provide a summary on some practical take-home message for those who just has joined us? Yeah.
Yes. See, acne is most common, which can be seen in early adolescents and teens. So we can't stop acne, but we can prevent the main complication of acne, that is scarring. See, the main goal of treating acne is to prevent scarring. So when there are light, small pimples, then you can take the over-the-counter medication and use it. And if it is a large pimple, then definitely you need to see a dermatologist, consult it, and get it treated properly. That is most important aspect. And you, especially in the summers, you can use light moisturizers, light makeups, and non-comedogenic products to prevent developing acne. And of course, the diet part of it is also most important. Diet includes avoiding milk and milk products, sweet sugar items, and drinking a lot of water.
So thank you so much, Dr. Karthik, for providing lots of information about the topic. I think our audience has got lots of useful information about the acne and its treatments. All the users you might have acne or have its signs and symptoms, no need to worry, as our expert at eGlobal Doctors are here to help you. So visit the website eglobaldoctors.com and download our application now. So thank you so much, Dr. Karthik. It's always a pleasure to have you in our live session. You always bring so much of information. So, audience, before wrapping up the session, viewers, are you looking for an expert second medical opinion for cancer treatment? Well, look no further because eGlobal Doctors is providing access to top oncologists from across the world. So, thank you so much, sir.
Thank you, Divya, for having me.
Yeah. So, thank you, audience. So, it's a wrap.